Hello, everyone, and welcome to Front and Center, hosted by me, Patrice Charlotte, Communication Specialist for Equity and Community Health. Each month, we'll be featuring the exciting work of our centers and departments, and this month is no different. For the last 25 years, the Center for Community Health Improvement has been working to address the social and economic factors that lead to better health, and today we'll have an opportunity to learn more. We encourage comments and questions, and we'll have a dedicated Q&A at the end of the presentation should time permit. We ask that you save questions until the end and submit them by using the Q&A function located at the bottom of your window. Should you have comments, please feel free to put those in the chat. And with that, I'll turn things over to Christy Egan, Executive Director of the Center for Community Health Improvement, to get us started. Christy.
Thank you so much, Patrice, and good afternoon, everyone. It is my pleasure to be here. As Patrice has stated, I am Christy Egan, and I'm the ED for the Center for Community Health Improvement. Our center's mission is to improve the health and well-being of the diverse communities we serve. The center oversees more than 38 programs and initiatives focused on the social and economic factors which have the greatest impact on health. Things like housing instability, food insecurity, opportunities for young people, access to quality jobs, and quality education. One of the ways we approach these issues is through our community coalitions. Guided by residents and working alongside our community partners, our coalitions work on the most pressing need of the community. Each coalition sits in the community, and while supported by MGH, is responsible to the community it serves. Rooted in a collective impact paradigm, slide please. The coalitions assess community needs, build community capacity, plan, implement, and evaluate all of their work through a cultural lens and a desire to create sustainable change. This afternoon, you're in for a treat, as you will hear from 3 of our coalition directors about their unique strategies and the collective impact they have in Charlestown, Chelsea, and Revere. It is now my pleasure to turn it over to my colleague, Sylvia Chang-Diaz, Director of our Revere Cares Coalition, who will provide a high-level overview of the coalition framework and then highlight some of the great work they're doing around food insecurity. Sylvia?
Thank you, Christy. Good afternoon, everyone. My name is Sylvia Chiang, and I oversee the Revere Cares Coalition. But first, let me tell you a little bit more about the coalition format. The center has been practicing the coalition. Next slide, please. The center has been practicing the coalition format now for many years in our communities. And the purpose for this format is to address complex issues. The format calls to bring every sector of a complex issue to the table, and we aim to what the collective impact most recently has identified as 5 conditions. We want the sectors to arrive at a common agenda around the issue. We make the stakeholders agree on measuring results and collect data. We coordinate so that their individual activities contribute to one same goal. And we allow the ability to stay in communication. This is to assure that they support each other, but also it helps in building trust. Now, as you see, the 5th condition is a backbone support. And that's exactly what we are. We are the dedicated staff with specific skills to oversee the coordination of the stakeholders. Next slide. So the role of the backbone support, again, is that we help the stakeholders develop and we guide the vision and the strategies. We support the aligned activities and we oversee that they advance policy, systems, and environmental changes. This will make the changes a little bit more permanent and sustainable. We mobilize funding around these activities. We help establish how to measure success. And we definitely and always need to build public will around these issues. Next slide. To be able to do this work, it requires meaningful community engagement. And looking back and trying to describe what that has meant for us is that it definitely calls for permanence in this community. It calls for understanding their history and trauma, language ability to communicate, to be transparent as much as possible, experience these communities and really listen to them. And we definitely need some skills. Next slide, let me tell you a little bit more about the Revere Cares Coalition. So Revere Cares was first established in 1997 as a substance use prevention coalition and very soon developed a youth initiative in partnerships with the school system that to the day runs very big and strong. It based on community health needs assessment practiced by the center in these communities. By 2007, the coalition expanded to a second priority, which was obesity prevention through our Healthy Eating and Active Living Initiative, or HEAL, as we like to call it. And by 2018, the coalition was ready for a third priority through the health needs assessment tool, and that was economic stability and mobility through workforce development and enhancing social capitals. Next slide. Let me tell you a little bit more detail about our HEAL activity. So Healthy Eating Active Living was structured in Revere as a co-leadership with the city of Revere, partly funded and partly guided by the state's Mass in Motion program. And since its inception back in 2009, it allowed us and exposed us to experience, learn, and work in the different sectors of what we now see was the local food system. We ran restaurant initiatives, corner stores. We to the day run a farmer's market. We enhance the environment with community gardens and school gardens. And for active living, we've striped bike lanes and urban trails. And we've organized playground community builds and try to develop ownership of the open space. We've also enhanced access to trainings and workshops and educational opportunities such as Cooking Matters. Next slide. All of this experience in the food system now take us to our next step, also funded by the new iteration of the Mass in Motion grant. We are planning on bringing the different stakeholders of these sectors of the food system to the table and form what we will call the Food Policy Council. Food Policy Council role will be to continue addressing the barriers to access food, oversee and recommend local policy changes. We hope that you will enhance the partnership between them, the different sectors of the food system, develop programs and services to support local interest, and definitely we hope it will build a more just and sustainable food system. Because of the partnership with the city is at the moment outfitting a building that has been housing the enhanced food pantry during the pandemic to what we will call in the future a food hub. And in it, it will house a commercial kitchen, packing and distribution capacity for small food business entrepreneurs, and more space for trainings and workshops. That this work also nicely overlaps with our economic stability and mobility priority, but this around food. So this is our work, and now let me turn it to Sarah Coughlin, who will share a little bit about the Charlestown Coalition. Sarah.
Thank you, Sylvia. My name is Sarah Coughlin, and I've been doing coalition work in Charlestown at CCHI for over a decade. And while I'm employed by MGH, I truly feel like I'm employed by the community and I'm accountable to the community. All of our work is informed and driven by community. And we do that through the community health needs assessment, through regular focus groups, and our continued engagement on the ground with residents and providers to take pulse of what the continued and evolving community health needs are and how we can address them collectively. So like Sylvia and Christy had referenced, we use a collective impact model. So I'm going to talk to you a little bit about what that looks like in real life. And so to kind of paint a picture of what that specifically looks like for Charlestown, we regularly meet with all of our key stakeholders in the community and representative of all of the sectors. So when we mean all of the sectors, we're talking about youth, parents, providers, the school systems, faith-based organizations, local businesses, law enforcement, et cetera, et cetera. And we work so that we're all working collectively to address the health concerns within the community. None of us can do any of these complex health issues alone. And so we really partner with the community to help build capacity of the community and do the work collectively. And so in Charlestown, how that looks, we have 5 bodies of work and task forces that we focus on based on the health priorities of Charlestown that the community has defined. I could spend a half hour on each of these initiatives that we do and the work that takes place in each of these task forces, but I'm just going to give you a quick synopsis of each of them and then an example of how it works in real life. So with policy and environmental systems change, the type of things that we do is mobilize our residents around relevant health legislation. We do a lot of get out the vote tables, registering residents to vote, registering young adults to vote. We work locally with our local politicians, so we're constantly involved in a lot of civic engagement, bringing in the local state reps and the city councilors and most recently the district attorney candidates to have forums with our youth and our community to really encourage people to get involved in local politics and feel the power when folks are engaged in sort of the laws and systems that inform health practices. We also within Charlestown High School work on systems changes to help them better manage student substance use. So we developed an alternative to suspension program for chronic substance use at the high school as well. So that's another example of how we look at systems change within organizations. Navigating treatment and overdose, the coalition formed in 2004 when Charlestown had the highest fatal overdose rates in Massachusetts. We're still challenged by substance use, and so we have a lot of work that we do in terms of prevention and intervention with substance use. A couple of the examples are that we assisted with Charlestown Municipal Court in helping them develop a recovery court specialty session to offer participants and defendants an alternative to incarceration for substance use related offenses. We partner with the health center. We're the community champion on the SUDS risk rounds team. And we work a lot in partnership in developing navigation through care through a recovery coach model in both New Health, Charlestown, and Charlestown MGH. With primary prevention, it's a huge part of our work. We focus a lot on evidence-based prevention curriculums within the school systems. We're in every single school system within the community. We work a lot on parent education. What are the changing and evolving signs and symptoms of use and how we can form parents on being, able and equipped to have these conversations with their youth early on. And we have a really robust youth prevention group. That's our youth component of the coalition, which is the Turn It Around group. And this is now an official program, a diversion program through the Suffolk County DA's office, and it's developed into one of the most robust youth enrichment programs in the city of Boston. We also developed a family support circle, which is a clinician to really address the challenges with high-risk youth and access to care. And then finally, because Charlestown is a neighborhood of Boston, but in comparison to other neighborhoods of Boston, do not have the levels of community violence in comparison. We don't receive a lot of city support in terms of trauma response teams or street workers or Youth Connect social workers. And so we really needed to build capacity within our own community to deal with the traumatic events we were experiencing as a community. So about 7 years ago, we formed our own trauma team. Our trauma team is well equipped and we've trained them through the International Trauma Center around psychological first aid and a bunch of different other works. And so they are ready and able to be deployed at any instance of community violence and any instance of overdose to support residents in real time. Next slide. So to just give you a quick example on how those are our 5 bodies of work, but we're consistently adapting and evolving based on whatever the community is dealing with at the time. And so most recently in Charlestown, we've been dealing with an increase in gun violence. And so I'm just going to give you an example of how we hear of an issue and how we mobilize residents and providers to deal with that issue. So over the last 3 months in Charlestown, we've had 2 15-year-old Charlestown residents shot, one in broad daylight while playing basketball and the other in his home in his housing development stairwell. We've had 2 loaded firearms confiscated from the local high school, where students had to be in lockdown, parents were uninformed. It was a really difficult and traumatic situation for a lot of the school culture. We had a huge shootout in the community in the housing development in which 73 shell casings were confiscated, were found. And most recently, we had a large shooting at our local high school graduation in which a lot of residents and providers and school personnel were incredibly traumatized. And so how we do this work in real time is that it's based on the already established relationship. So because we've already had this framework, we're ready and able to adapt and evolve to community needs in real time. So in any of these instances, we've deployed our trauma team immediately. So we had 10 trauma team responders at the graduation shooting, providing psychological first aid to students, to personnel, to teachers. We were able to rally with the healthcare centers. So the next morning at Charlestown High School at 7 a.m., we had about 10 providers through the Charlestown Health Center, New Health Charlestown, within our trauma team and other clinicians in the community that were offering support in real time to students and to personnel. We rallied and had held resident groups in the housing development for residents that were feeling unsafe and not able to leave their home, in partnership with the Boston Police Department, so that they could have real-time information on where things stood with a lot of the investigations for the shootings that were happening. We've also done a lot of work with our youth and our group and partnering with clinicians at MGH Healthcare Center to have students learn ways of self-regulation, way of moving trauma through their bodies, and how to sort of make sense of these things that kids just shouldn't have to make sense of at that age. And so now our kids have taken a lot of that work and they're developing their own TikTok so that they're learning these skills and that they're sharing them with other youth in the community on how do you deal with stress, how do you move trauma through your body, how do you kind of make sense of these unfathomable situations that they're forced to deal with. And then in partnership with them, the MGH Coalition to Prevent Gun Violence, we made a really powerful documentary kind of film that we're using on community panels to continue the dialogue and engage residents on how we can look at the root causes of gun violence and how we can really support people that are seeking attention in the community. So that's just one example of sort of how we evolve quickly and we meet the community needs, when, especially in times of crisis in a small community. The coalition plays a really big part of that. Because we are convening all of the partners, we're really able to move quickly and know the right people to go to and really get and address these needs in real time in the community. So I'm going to pass it over to Jen so you can hear a little bit about the work that takes place in Chelsea.
Thanks so much, Sarah. I'm so happy to be here today. My name is Jen Kelly. I'm a social worker and I'm also the director of the Healthy Chelsea Coalition. So just as Sylvia and Sarah really did a great job explaining, we really try to engage the community to try and change policy, systems, and environment to improve the health of our community. So Healthy Chelsea started about in around 2010. And it started by, similar to how Sylvia described, healthy eating, active living initiatives. But really since the pandemic began, there's been a real emphasis on food insecurity. We knew it was an issue in Chelsea before the pandemic, but thanks to the great work of Ron Fishman and his bringing the work of the longstanding Chelsea Hunger Network under the umbrella of Healthy Chelsea, there's been a really amazing amount of work done in this area. We also work on preventing and reducing youth substance use. As Sarah mentioned, very similar strategies. And mental health is, you can't talk about substance use prevention without talking about mental health and wellness. So I'm going to talk a little bit more about that in a few minutes. We also focus a lot on youth leadership development, and we really try and build young public health advocates through the work of our youth food movement, which works on food justice issues in the high school, and our Teen Action Project, which focuses on youth substance use prevention and mental wellness. Another big body of work that we're proud of is, again, how do we change the policy, systems, and environments to improve the systems of care for all our families with children with the age of 0 to 6. And finally, a big goal that we have is really how can we increase community connections? How do we always increase partnerships? How do we keep people in the know about the latest resources? Chelsea is a really special place. I'm of course very biased, but people in Chelsea really love to work together, and it's always very encouraging and heartwarming to see how much people care about their community. So that makes my work so much easier, and the work of all of our staff really engaging the community and sharing all these great resources. Next slide. As many of you probably are aware, Chelsea was incredibly hard hit during the pandemic. And the city of Chelsea really mobilized to form about 10 or 12 different pandemic response teams. Healthy Chelsea was really honored to ask to be led not only the food insecurity team, but also the mental health and wellness pandemic response team. So we gathered many existing coalition members, added many more mental health and service providers in Chelsea, and we meet every other week since March of 2020, and we've had over 60 meetings to date, which is really incredible, the commitment of this group. So mental health, again, as many of you preaching to the choir, I'm sure, but we have a real mental health crisis in our country. Our residents' ongoing stress, anxiety, grief, isolation. So what this group really did in the beginning was, how do we share as much as we can and get the word out about how to access basic needs resources, which so many of our residents were struggling with. Another big push was to coordinate referrals among mental health providers. We have such long, incredible wait lists. How do we share referrals? How can we reduce the wait time for people to get that? We also did some community panel discussions, which were really helpful in English and Spanish in collaboration with the City of Chelsea. We partnered with Dr. Luana Marquez of MGH, who helped create some mental wellness programming at La Colaborativa's summer youth program for over 150 youth. And we really worked with Benson Henry and International Trauma Center, because our staff teams all over the city were really burnt out. So how do we help support them as well? Next slide. What we also found was, because of the incredible wait list to access individual care, the group really wanted to focus on increasing non-clinical community mental health supports. So at last count, the MGH Chelsea Behavioral Health Department had a wait list of over 500 people, which is just really astounding. So, but you know, individual therapy might not always be absolutely necessary. If we can provide other supports in the community, such as support groups, case management, and other supportive services to alleviate stress, find a network of folks for support, and really trying to alleviate some stress and anxiety to hopefully prevent someone actually needing individual therapy. Another way we've been really doing that is there's a state model called Family Resource Centers that's under the DCF umbrella, and we are really heavily advocating. There's a wonderful FRC in Everett. We really are strongly advocating to replicate those kinds of resources. They do navigation services, access to care, provide a whole array and menu of support services, groups, all sorts of wonderful trainings and workshops. So we are really working hard with the city to potentially use some ARPA money to recreate that in Chelsea. And like Sarah mentioned before, organizing trainings for the community. There's a model called Mental Health First Aid, very similar to regular first aid. And it's for lay people and non-clinical people. So how do you recognize signs and symptoms? How do you really help in a situation when someone's experiencing a mental health crisis? And a subset of that is teen mental health first aid, where they train a whole grade of students to provide not only a greater understanding of mental health and wellness, but to provide peer-to-peer support. But something we're so incredibly proud of to help reduce stigma is Yasmin Hung's wonderful work with our Teen Action Project. The The students and Yasmin and adult advisors have worked incredibly hard to create a social marketing campaign to reduce the stigma and help encourage teens and their families to have honest conversations about mental health and wellness. So we hope you might take the time to follow our Instagram page, which is one piece of the campaign, and that's at Chelsea_wellness. So we're so proud of our young students, and that's really an incredible piece of the work that we're all so proud of. So thank you so much for listening, and I'm going to turn it back over to Patrice.
Thank you, Jen. And thank you, Sylvia, Sarah, and Christy for such an incredible presentation overview of the work coming out of CCHI. I'd like to now open up the Q&A portion of the webinar. We are getting close to the end of our time together, so we may only have time for one question. But to submit questions that we can pass on to the panelists after, feel free to use the Q&A function and we'll ensure that it gets to them. So we did receive a few questions beforehand, so we're going to start there. Up first, if each of the panelists could respond, maybe taking a minute to do so. Our first question is, what are you most proud of? So I'm not sure, let's see. Jen, do you want to just kick it off?
Sure, I can actually just repeat almost what I just said. The youth work is always just so inspiring. It's just so important to have the youth voice in all of the work that we do. So the work around being able to facilitate that is really rewarding. And again, just to say what an incredible community Chelsea is and how much people really want to work together. And being a part of that is something I'm most proud of. Would Sarah like to go?
Sure. It's hard to pick one thing because there's so many phenomenal things that take place at the coalition level. But I think I would say the way we mobilized during COVID, especially around addiction needs. There was, as most people know, social connections is such a foundation to healing and recovery. And when people are isolated, not able to attend, AA meetings, when the churches were closed, we really had to think creatively about how to get people's needs met in the community. We ended up doing outdoor meetings. We got a big tent. We tried to do harm reduction. We had masks and hand sanitizer and all sorts of things readily available to try to make people as safe as possible, but still allowing people to connect with one another, to really receive their medicine. In partnership with the health center, we get tablets for people to enter, have virtual appointments, and we were just on the ground. So I've never been more proud of my team, and also supporting the youth during that time as well. We were doing exercise groups over Zoom and trying to get their bodies moving and helping them access internet and access services for schools and helping their families get food. And we were really just all collectively working together to address these really dire needs for residents for a straight 2 years, and was just really, really proud of my team. So I think I'll go with that and pass it to Sylvia.
Yeah, thanks, Sarah. I think it's just so gratifying to see how the community comes together to rally around the topic, and later to see the impact and the permanence of the outcomes that we're able to achieve. Sometimes very slow to get there, but at the end, it was definitely worth the journey.
And I'm new in my role in overseeing the coalitions. And I will say that I've been impressed with the sophistication, the compassion that our coalitions have in supporting and working in tangent with the community. It's really a fine line because, in our own families, not everybody agrees. And so too does that play out in communities. And Sarah, Sylvia, and Jen do a wonderful job, and their teams do a wonderful job of making sure that everybody is heard and seen.
Thank you all. So we have reached the end of our time together today, but we do encourage you, like I said, to ask questions and remain connected. To continue today's conversation, feel free to connect with our presenters via the social channels that appear on your screen. Thank you again for attending. We do hope to see you at our next Front and Centered, which is happening on August 25th at noon, where our medical liaisons will share their experiences with multicultural, multilingual outreach in our communities. Thank you, everyone. Take care and have a good afternoon.